Hello. Today we'll be talking about Multihance. Multihance is a gadolinium-based contrast used within the magnetic resonance imaging department at Ochsner. The contrast is ordered from Braco, a national and foreign company that originated across the pond in the United Kingdom. The average cost of a case of 5 bottles of Multihance is approximately $259. Multihance is an ionic solution. It is hypertonic, which means that its osmolality is higher than that of the osmolality of blood. Because of its higher osmolality, Multihance is considered an ionic compound, which can lead to more adverse drug reactions. The contrast was originally approved by the Food and Drug Administration on August 1, 1997 in the United Kingdom. It has become widely used within the MRI department in multiple places for imaging of the CNS, liver, and magnetic resonance angiography. This is simply MRI to image the blood vessels. Multihance did not make it to the U.S. until 2004, which it was approved by the FDA. Multihance is introduced into the body intravenously through a rapid bolus injection followed by a saline flush of about 5 milliliters. The contrast is excreted through the kidneys and via urine. The patient is instructed to drink lots of water post-examination to excrete this contrast. Multihance is primarily used to image the central nervous system, such as lesions, and it can also evaluate suspected renal issues or aortoiliofemoral occlusive vascular disease. This is simply when arteries become narrowed and stenosed and blocked. The aorta is the main artery of the body, which everything branches off of, which means it should be treated immediately when found. The contrast shows as radiopaque on MRI images. Contradictions of the drug are if the patient is allergic and hypersensitive to gadolinium-based contrast agents. The most common reactions found in clinical trials were nausea and headache, though such things rarely occur during imaging procedures. This is Multihance. As you can see, it's stored in a clear container. It is also a clear and colorless solution. There are about 20 milliliters in each of these little packages. Right before the exam starts in MRI, they draw up this solution, they inject it into the patient, and then shortly after that they follow it with that 5 milliliter saline flush. And it is radiopaque on the images, so they can see what they need to see.
Hello, today we'll be talking about Eovist, also known as
gadoxetate disodium.
That's right, folks. One more time for the crowd.
Gadoxetate disodium.
Eovist, which you can see right here, is a clear, colorless, and can be up to a pale yellow aqueous solution. It's a gadolinium-based contrast agent indicated for IV use in T1-weighted MRIs of the liver to detect and characterize lesions in adults with known or suspected focal liver diseases. The recommended dose of Eovist is 0.1 milliliters per kilogram body weight, and it's administered undiluted as a single IV bolus injection at a flow rate of approximately 2 milliliters per second. Each milliliter of Eovist contains 181.43 milligrams of gadoxetate disodium and is available in single-use vials. There are no contraindications, but there are many adverse reactions. One important adverse reaction is called nephrogenic systemic fibrosis, also known as NSF. What NSF is a rare and serious syndrome that involves the fibrosis of the skin, joints, eyes, and internal organs. And this is due to the exposure to gadolinium-based contrasts. Minor adverse reactions are headaches, dizziness, pruritus, and feeling hot and bothered. It's very important to get blood work prior to the injection of Eovist because if there's an elevated bilirubin level that's greater than 3 milligrams per deciliter, that can reduce the hepatic contrast effect that the Eovist has. Also, the paramedic compound EVIS develops a magnetic moment when it's placed around or within a magnetic field. This moment produces a local magnetic field yielding enhanced relaxation rates of water protons within the body. This relaxation results in an increase in signal intensity, which increases the brightness of blood and tissue that's seen through the MRI. EVIS is eliminated through the kidneys and through the urinary system. An advantage of using EVIS during an MRI is that it allows or assists in the demonstration of bowel leaks and gallbladder obstruction. But one disadvantage that it really has may cause a severe respiratory motion artifact in the arterial phase, which will put a limitation on the evaluation of the lesion.
Hey you guys! Hi Amy, I wore pink lipstick just for you because I know you like it. So today I'm going to be talking about my contrast media called Gadavis. Gadavis was discovered by Jean-Charles Magrenega. Gadavis is a paramagnetic contrast agent that is used in MRI and is injected intravenously. It is a silvery metal that reacts with oxygen and water, and it's going to look like this. This contrast media is also used at Ashland Medical Center in the MRI department and also used in the fluoro department when doing orthograms. The cost of this contrast media, well, it depends on the quantity that is being purchased, and it ranges from $600 to $5,000. Costs a lot, right? And it comes in a clear glass bottle that has a rubber stopper that needs a needle to draw back the contrast. And this contrast media bottle is a decent size, and they have the rubber stopper. And the tech uses it until the bottle is empty, so they use it multiple times, or until it reaches its expiration date. And each tech will sign the initials and a date last used and what time it's supposed to be expired. Make sure you also keep it at room temperature. This contrast media is radiopaque, therefore it isn't see-through. Gadavis has a high atomic number of 64, which means the higher the atomic number, the more attenuation. Gadavis has a density of 1.3, osmolality when at 37 degrees Celsius is 1603. And its viscosity at 37 degrees Celsius is 4.96. Its pH ranges from 6.6 to 8. It also have a low toxicity. I know a lot of you don't know what that means. Well, the degree to which a substance can harm human or animals. This media is introduced intravenously and is used to improve internal structures. Examples increase the visibility of inflammation, blood vessel, and torn tissues. This media have a lot of contraindications, such as patients with kidney failure, patients who are on dialysis, and patients whose GFR is less than 30. All of the previous things that I stated, if you have any of these, then contrast cannot be given to you. There are some side effects of this media. This media have a mild adverse reaction such as dizziness, headaches, nausea, or tissue irritation. The dosage amount is also very important. The maximum amount of Gadavis that a patient can receive during the procedure is 10 cc's. It goes by age and weight. If a patient is 20 years old and weighs 150 pounds, then you will round down, which is 14, and then divide by 2, which is 7. So the amount that will be injected into the patient is 7 cc's. If the patient is 2 years old and weighs 40 pounds, then you will also round down, and the patient will receive 2 cc's. The reason why Gavitus is diluted in orthogram and not MRI is because Gavitus isn't supposed to be injected into the joint space. It can cause bodily harm, so by diluting it, reduces the chances to slim to none. That's why we would send you straight to MRI after and have you place your arm across your belly to try and keep it in the joint space and not to go anywhere else inside the body. Also, the body dissolves this contrast quickly, and that's another reason why you'll go straight to MRI.
My negative media is nitrous oxide. Nitrous oxide was discovered in 1763 by British scientist Joseph Priestley. It has been extensively used over the past 150 years. Nitrous oxide is known commonly as happy gas or laughing gas. It is used to this day as an anesthetic agent and is widely known to be used in the field of dentistry to knock the patient out for procedures. Nitrous oxide is administered through inhalation and is excreted through the lungs and respiratory tract. It is classified as a negative media and therefore is radiolucent when used in imaging procedures. Nitrous oxide's viscosity is approximately 1.37 millipascals, which means that the contrast agent is not thick by any means. It is in a constant gaseous state. Nitrous oxide is a very safe drug. There are very few contraindications to using this drug. Most of the reactions and side effects which occur when the drug is used recreationally. Nitrous oxide is used outside of the medical field in car racing and food processing, among other things. Like all drugs, nitrous oxide is mandated by the Food and Drug Administration with regulations of use, storage, and labeling requirements.
Good morning. Today we'll talk about Easy Gas. Easy Gas is an antacid and anti-flatulent drug. It relieves indigestion, heartburn, sour stomach, upset stomach, or gas. It works by neutralizing stomach acid, which helps relieve upset stomach. It breaks up gas bubbles, which makes gas easier to eliminate. Do not use Easy Gas effervescent granules if you have appendicitis or a blockage in your bowels or esophagus, or you are on a low-salt diet. Before using Easy Gas, you should make sure you do not have a history of stomach or intestinal bleeding, congestive heart failure, swelling, liver problems, kidney problems, a decrease in the amount of urination, or rectal bleeding from an unknown cause. If you have a pregnancy-induced high blood pressure. How to use Easy Gas. Using this alone as an antacid, you would just take half a content, place in the back of your tongue, wash it down with half an ounce of water, repeat with the remaining content of the packet. If you're using this for a fluoroscopic study, it is recommended that you take this immediately with water and then are asked not to belch. You can make sure you do not belch by swallowing your saliva. In a fluoroscopic study, using this gas allows your stomach to be distended so that every structure of the stomach is seen. This is used mainly for a double contrast study with the use of barium. All medications may cause side effects, but many people have no or minor side effects when used in small doses. No common side effects have been reported with this product. Seek medical attention right away if any of these severe side effects occur, such as rash, hives, itching, difficulty breathing, tightness in the chest, swelling of the mouth, face, lips, or tongue, black, tarry stool, headaches, irritability, nausea, vomiting, weakness. Proper storage of Easy Gas is at room temperature or between temperatures of 59 to 86 degrees Fahrenheit, 15 to 30 degrees Celsius. Store away from heat, moisture, or light. Do not store in the bathroom. Keep it out of reach of children and pets. Easy gas is a negative media. It's radiolucent. The description of this product, once opened, is white to off-white granules. It's manufactured by Bracco EasyM. It retails for about $144.16 for about 50 packets, or $2.80 per packet. The net weight is 4 grams.
Helium. We all know what helium is. Helium is a light, tasteless, odorless, and colorless gas, and the atomic number 2. But do we really know what helium is? Did you know that helium is the lightest noble gas? Or maybe you didn't know that it was the second most abundant element in the universe. Helium is used for a lot of different medical reasons. One, it can be used in cooling off superconductor magnets in MRIs. Also, it decreases the resistance of air and promotes the airflow into the lungs. It's also used in pulmonary MRI because it gives finer detail using the helium ion microscopy. It's a safe alternative as an insufflant in high-risk patients that are undergoing laparoscopic renal surgery, which is basically putting a camera into the abdominal cavity. It hasn't produced respiratory acidosis that's associated with the use of CO2. There's a method called SEOP, which is the polarization of helium. Patients would inhale this polarized helium along with medical nitrogen in a bag for routines that require holding their breath. This method is safe and requires no ionizing radiation dose and can be repeatedly inhaled. It can also provide additional information regarding lung oxygenation that wasn't possible with the traditional HRCT, which is the high resolution computed tomography, or MRI. The downside of using helium is that it actually increases the minimum alveolar concentration for volatile anesthetics and is also shown to produce or result in convulsions. Helium is therefore characterized as a non-immobilizer, which is a gas that does not induce anesthesia, but it may also have other biological effects.
Saline, sodium chloride, or NaCl 0.9%, is a parenteral fluid that is still used in medicine today. At Ochsner, it is used in many different departments throughout the hospital. Within the Department of Radiology, fluoroscopy procedures use the solution during injection and arthrogram. The solution is radiolucent. It does not show up on X-ray images. Per Mr. B, the average cost of a single unit of sodium chloride 0.9% is 92 cents. There are different types of this solution, such as different concentrations of sodium chloride. The difference between NaCl 0.9% and NaCl 0.45% is that NaCl 0.9% is isotonic, which means there's no net movement and it's actually safe for the patient, while NaCl 0.45 is hypotonic, making it more dangerous to the patient. It is an ionic solution. It associates within water. Osmolality is about 310 milliosmol per liter, which makes it extremely close to the osmolality of blood, which is about 280 to 300 milliosmol. 280 to 300 milliosmoles. The media is introduced intravenously and is excreted through the kidneys and urinary tract. There is no known contradiction to this drug, but there are some reactions that may occur. Reactions to watch for are pyrexia or fever, extravasation, hypovolemia, or dehydration, venous thrombosis, which is a clot that forms in the veins, and infection at the injection site. Saline is designed for the use of diluent and delivery system for intermittent IV. Administration of compatible drug additives. Solution is isotonic, which means it is equal in pressure. No net movement between solution occurs. Best used for patients, and it does not change the homeostasis of the human body when used. Primary function is it controls water distribution, fluid balance, osmotic pressure of body fluid. So there are no contraindications of this drug. Some can be clinically detrimental to those with congestive heart failure, severe renal insufficiency, sodium retention, or sodium retention with edema. This product is made by Braun and in the USA. That's all I got.
The parenteral fluid that I will be talking about today is saline NaCl 0.45%. The media is still used as a source of electrolytes and water to the patient if they're dehydrated or for some other reason. It is a clear and colorless solution. It is ionic in its properties because it dissociates in a solution that it is injected into. The difference between NaCl 0.45 and NaCl 0.9 is that half of the sodium chloride concentration is used in saline 0.45. Saline 0.45% is a hypotonic solution, meaning it is slightly more dangerous to the patient than NaCl 0.9 because that's an isotonic solution, which means it does not disrupt the surrounding pressure when injected into the vein. The pH of saline 0.45 is approximately 5.6, which means that it is slightly on the acidic side of the pH scale. It is introduced via IV and is excreted through the kidneys and urinary system. The dosage of the saline is dependent on the patient's condition, age, and weight. There are no known contraindications of this drug, but there are a few reactions, such as febrile response, which is just watch to see if the patient has fever, infection at injection site, venous thrombosis, which is a clot that forms within the vein, extravasation, which means that there's a leakage from that vessel into the surrounding tissue or surrounding area, and hypovolemia. If any of these reactions occur, discontinue the infusion immediately. Another fun fact, the numbers after the solution name stands for the amount of sodium and chloride within the concentration of water.
A lactated ringer solution, which is what we have here inside the bag, is a sterile solution used to replace fluids and electrolytes in a patient who has unbalanced blood fluid. It consists of sodium chloride, 6 grams per liter of it, 3.1 grams per liter of sodium lactate, 0.3 grams per liter of potassium chloride, and 0.2 grams per liter for calcium chloride. Dosing an individual based on the patient's age, weight, ongoing treatment, and clinical condition. Some side effects of lactated ringer solution are chest pains, abnormal heart rate, decreased blood pressure, troubled breathing, sneezing, itching, and headache. Venous thrombosis or phlebitis at the site of injection is also a side effect. It is also contraindicated in patients with known hypersensitivity to sodium lactate. Lactated ringer is also used to induce or to bring out the urine output in patients who have renal failure. For fluid resuscitation, the usual rate of administration is 20 to 30 milliliters per kilogram of body weight per hour. Large volume resuscitation over several hours of the LRS, which is the lactated ringer solution, maintains more stable blood pH compared to using normal saline. The pH of the lactated ringer solution is 6.5. Some risks are air embolisms and extravasation. The osmolality is 273 milliosmoles per liter. The ringer's solution only refers to the saline component, whereas the lactate is metabolized into bicarbonate by the liver, which can help correct metabolic acidosis. This solution is grouped as crystalloids under IV fluids. Don't administer this lactated ringer solution simultaneously with citrate anticoagulated or preserved blood through the same administration. This is because there's a likelihood of a coagulation to occur. This solution comes in a 250 milliliter bag, 500 milliliter bag, and a 1000 milliliter bag. This what I have in my hand is a 500 milliliter bag. These are stored at room temperature, and they're also administered through IV.
Hey y'all, it's me again. So this time I'm going to be talking about parenteral fluid. And I'm going to be talking about D5W, dextrose, 5% in water solution. It is a source of calories, electrolytes, and water that will help keep the patients properly hydrated. It also contains glucose. Glucose provides energy, 4 kilocalories per gram. So a 5% glucose solution provides 0.2 kilocalories per gram, milliliters. No, this media is not still at Oshner that I'm aware of, but I could be mistaken when I did my research. So even though this contrast media, dextrose, is common, it is not used at Oshner. The cost of this media is $59.99 from Baxter. 36 comes in a case. Each bag is 250 milliliters.